Ever wish your EHR notes wrote themselves? What if AI could cut your charting time by 70%? If you're a doctor, nurse practitioner, or PA, you've probably stayed late finishing notes more times than you'd like to admit. Sound familiar? You're not alone. Over 60% of clinicians say documentation is one of the top reasons for burnout. But in 2025, AI scribes are changing everything. They listen, summarize, and sync directly to your EHR. So you focus more on patients and less on paperwork. Let's start with Suki AI, the voice-enabled digital assistant designed to reduce documentation time by up to 76% per note, according to users. Built for solo physicians and small practices, Suki works on your smartphone or desktop and integrates with major EHRs like Epic and Cerner. You just speak naturally. Patient presence with cough and fever. And Suki auto-generates structured notes, inserts ICD-10 codes, and even fills orders. Compared to legacy tools like Dragon, Suki doesn't just transcribe, it understands intent. That's the game changer. Setup takes minutes, and the UI is as friendly as using Google Voice. Pricing starts around $150/month per user. Access it at Suki.ai. Can AI finally give you your evenings back? With Suki, maybe. Next up, DeepScribe, the ambient AI scribe that listens passively during appointments and turns conversations into EHR-ready soap notes. Perfect for outpatient clinics and busy primary care offices, DeepScribe runs in the background with no wake word. It captures everything in real time, filters irrelevant info, and delivers notes by the end of the visit. According to internal benchmarks, it saves providers up to 3 hours a day. Doctors say it feels like having a silent assistant who never sleeps, never mishears, and never slows you down. Implementation takes a few days with live onboarding support. Pricing starts at $99/month, higher tiers for custom EHR integration. Learn more at DeepScribe.ai. Would you trust a bot with your medical notes? Thousands already do. If you're part of a large hospital system, you've probably heard of Augmedix. Unlike the rest, Augmedix blends AI with live medical scribes in real time. It captures audio during visits, processes it via NLP, and has a human QA layer for unmatched accuracy. The result? 100% HIPAA-compliant notes that integrate into major EHRs like Epic and Athena. In trials, Augmedix saved up to 15 minutes per patient. That's 5 hours a day in a 20-patient schedule. Setup is guided and white glove, with enterprise-grade support. Pricing, custom enterprise pricing, more at Augmedix.com. Now let's talk about Nabla Copilot, the newest contender that's winning hearts with its free tier and blazing fast summaries. Designed for tech-savvy docs and startups, Nabla uses ambient listening to automatically draft notes while you speak to patients. It supports multiple languages and highlights follow-up actions. Unlike others, Nabla has a GPT-style chat interface for summarizing, asking questions, and even generating patient education summaries. It's great for practices that want lightweight, low-cost AI with flexible deployment. Pricing: free tier available, premium plans. TBD, try it at Nabla.com. Which tool would you actually use with real patients? Nabla might be it. Finally, we have Nuance DAX, backed by Microsoft's cloud and voice tech. Built for large systems and enterprise clinics, DAX listens during exams, generates rich clinical narratives, and syncs directly into Epic, all powered by Azure. Unlike Dragon, which required command-based dictation, DAX is fully ambient, smart, and secure. It's also the most scalable, supporting multi-specialty teams, remote workflows, and compliance needs. Pricing: enterprise contract only. Learn more at Nuance.com/DAX tool. Time saved best for starting price EHR support. Suki AI, 76% solo practices, $150 per month. Major EHRs, DeepScribe 3, HRS day clinics, $99 per month. Custom Augmedix 15 min-app PT, hospitals, enterprise, full Nabla, Copilot 50-60%, startups, techies, free, premium, basic Nuance DAX, 50%/note, enterprise clinics, enterprise Epic, Cerner. Whether you're drowning in charts or dreaming of getting home on time, AI Scribes might just be the best upgrade to your workflow in 2025. So, which AI Scribe would you trust in your clinic? Drop a comment below. Let's compare notes. Don't forget to like, subscribe, and share this with a healthcare friend who's still stuck typing all day.